Autism is considered the fastest growing developmental disability in the United States. It affects roughly 1 in 88 children. But as NBC 25's Jane Park reports tonight, most families in Michigan have little or no access to treatment. Jane?
That's right, Bill. If parents wanted to get their child diagnosed with autism and treated for it, insurance companies simply didn't cover it. They had to rely on the school system and pay out of pocket for other treatment, but it's hoped a new state law will change that.
Michigan.
It's a busy Tuesday for 15-year-old Michael Bell. After school, he sits with his private tutor. This week, he's learning state capitals.
Tallahassee.
Michael was diagnosed with autism through the Saginaw County Head Start program when he was 2.5 years old.
We try to really push Michael to be independent, as self-independent as he can be.
Michael has made a lot of progress by working with tutors and his special education teachers at school.
It's a daily thing that we have to watch.
As for medical care, Mom Pam had to become the expert. She keeps a close eye on Michael's diet and a bevy of other health issues common among autistic children. We've just been trying to work with as many different medical professionals out there to make sure we're getting all the correct care for him. But Pam quickly learned not to use the word autism in the doctor's office for fear the insurance company would get in the way of treatment.
Virtually every policy in the state of Michigan denied coverage for evidence-based treatment for autism.
In fact, it was tough to even find qualified doctors or therapists who could provide the recommended intensive speech, behavioral, and occupational therapies.
There were only about 30 in the entire state of Michigan for 15,000 kids. Michigan was one of the 10 worst states to be if you had autism.
For several years, efforts to update the insurance code stalled in the legislature. But when Lieutenant Governor Brian Calley learned his own daughter had autism, he pushed for reform.
I thought, with or without changes in the law, my daughter's going to get what she needs. But the average person had no chance whatsoever in making sure that their kids got what they needed.
Last April, Michigan became the 30th state to sign autism insurance reform into law. Insurance companies now have to cover for the diagnosis of autism and treatments that were often too expensive for the average family. A small victory for Calley and some 50,000 children and adults in Michigan living with autism.
You have to treat them the same way you treat somebody with heart disease or cancer or any other type of diagnosis.
At the age of 15, Michael is well past the recommended age for early intervention treatments. But Pam says she will finally be able to get Michael medically diagnosed with autism in hopes that he'll get more tailored treatments. Being comfortable walking into a pediatrician's office or even a specialist and not worrying about using the word autism. Calley says reforming insurance coverage is just one component in helping people with autism succeed. He also wants to see doctors and therapists working closely with public schools to provide integrated care.
The more all of that can be coordinated to work together, the better the results will be for the student. And so I think that's the next big frontier for kids with autism.
As for Michael's next frontier, he's growing up fast. He'll be working at a dental office this summer, building new skills to tackle new challenges every day. I guess we always want to reach for the stars in the sky for him, and that's what we're going to continue to try to do. Well, April is Autism Awareness Month, and local autism support groups have planned various fundraisers and events. We'll post that information on mynbcnews.com. You can also learn more about the new insurance law and watch my full interview with Lieutenant Governor Brian Calley. Bill.